Hello, I'm Bill Reiner. I'm a child and adolescent psychiatrist and also have a past history of being a urologist. I'd like to talk to you a little bit today about adherence versus compliance in kids with bladder exstrophy, and let me explain to you what I mean by that. In medicine, we love to talk about people not being compliant with the plans or the programs that we set up. The problem with using the word compliance, and it's the problem we as physicians tend to have, is that what we mean is you're not following our directions. You're not doing what you were told to do, and what we're telling you to do is important to your health. Well, that's how we look at it as the doctors. If we were actually the patient, we would look at it differently, and we'd look at problems of adherence or sticking with what the plan is. And it turns out that sticking with medical plans is not easy. It's not easy for anybody. It's not easy for adults who are sophisticated, but it certainly isn't easy for kids who aren't going to be sophisticated anyway, not about medical issues. So it's important to really understand that we expect way too much of kids and adults, which is another way of saying of kids and parents, because there's a limit on how much we can adhere to a given plan or a given regimen, even as the parents. In studies that have been done on kids who have chronic conditions and chronic illnesses, it turns out that over a short period of time, only about 50% adherence is seen. And I don't mean 50% of the kids adhere to the plan or 50% of the parents stick with the plan. I mean that overall of the things that we ask kids to do or parents to do with their kids, about half of them actually end up getting done. Chronically, that is, over longer periods of time, that same plan becomes, we stick to that same plan as kids and parents less and less, not more and more, but less and less. So it's important to realize that this is simply a human issue that we have to figure out how to deal with. So we need to have some interventions. We need to find ways to help kids manage their disease and help parents help their kids to manage their disease processes, their surgeries, their procedures, and all of the things that those require, and we have to do it in a way that is possible. So again, if you hear us talking about compliance, you might just interrupt us and say, well, you know, my kid's trying. He's doing the best he can, or she's doing the best she can, and by the way, I'm doing the best I can, so we're trying to stick with the plan. It just isn't easy. And that may help us as the physicians to realize that, yeah, everybody is trying, and it isn't easy. So we have to face the human aspect of all of this. There are many aspects to it, and I'm only going to go into a few. One of the ones I bring up repeatedly is the age appropriateness. Often we as adults think that children understand us much better than they understand. Children can speak beautifully, and the older they get, the more verbal they get. But understanding what's spoken to them is a whole different realm, a whole different experience, and it takes a different set of development. It takes longer. It's not easy. And as adults, we tend to speak to them in very complex terms, complex sentences, and they don't understand them. They may understand part of the sentence, and they may understand the other part of the sentence, but when you put the two parts together, it's beyond younger kids. So that's something we need to recognize, not just as physicians, but as parents. So the age appropriateness is important in terms of understanding. It's also important in terms of what we really can expect our child to do. For example, can a child do intermittent catheterization at the age of 5? Technically, most kids could probably do it. Probably the girls would do it easier and better than the boys, probably. But that's different than really having them do it. So that's one aspect. Another aspect is what the kids can do for themselves in managing their condition is not necessarily what they will do. And if you ask them if they've done something, they generally will want to please you, so they're going to say yes, whether they've done it or not. That doesn't stop in childhood, of course. That goes on into adolescence and sometimes into young adulthood. In fact, sometimes goes on into marriages, so that, you know, we husbands will say the same things to our wives when we really haven't done them. So those are just things to recognize, because I think that's very important. And another side of that is not just whether our child did do any of the things we asked them to do, but how well did they get them done? I don't mean how well did they accomplish the intermittent catheterization. I really mean how well did they do the overall picture? Did they get half of it done? Did they get 3/4 or 1/4? And then you can kind of build on that. So I think those are issues that are very important. Again, remember that we physicians tend to overestimate the ability of a child to carry something out. Just as I mentioned, we overestimate the ability of a child to understand what we're asking. So we need to look at the development of the child, which again is the age. We need to look at how aware the child is of a given set of issues or problems. 3 children of the same age may have 3 different levels of awareness, so that's important to recognize. It doesn't say anything about how smart we are, it doesn't say anything about how cooperative we are. It's just talking about what really do you recognize and understand about your condition and about what needs to be done for your condition. We also have to recognize that there is a very poorly developed sense of future in children and of future consequences. Even adolescents who really understand what future consequences mean don't necessarily put them together in terms of behavior. It's one reason why teenagers will often go out and do things that we say, why did you do that? That was clearly stupid. And you might look back on it at age 25 and say, that was stupid. Why did I do it? Well, it's because we didn't quite connect the dots. We can connect the dots as teenagers. We just don't always do it. The other aspects are social issues. What do issues of financial abilities and neighborhoods and where we live and where we go to school, what differences do those make? We really don't know much about that. It hasn't been studied too much, but some of those social issues may well be very important. I think the other aspect is responsibility. We love to talk about our kids taking responsibility. I think the important thing, though, to recognize is if we expect our kids to be responsible, we have to check up on them. Maybe a lot at times, especially with important issues. The other aspect is how capable a child is of carrying out a responsibility varies hugely across the same group of people, the same age group, the same whatever you want to look at. It just varies. It can vary within the same person in the same period of time depending on what's being asked of them. So responsibility and the sense of responsibility is not something I dwell on a lot with kids. It gets in the way. The concept does. The other aspect is the complexity of what we're asking them to do is important. Passing a catheter through an opening isn't very complex, but the whole process of, again, being aware that I need to empty my bladder, being aware that I have to empty it even though I don't feel anything, that I need to get ready, I need to get the parts ready, I need to pass the catheter, I need to get the that's a hugely complex set of issues. Not easy, nothing easy about it. And I think it's also important to realize that we need to supervise our children. We need to watch them to really know if they're doing what they need to do. We need to watch them while they're doing it. We can't depend on them to report accurately. But we also need to give them feedback. So when they are able to carry out something with our supervision, we need to give them feedback and say, you know, that really was a good job. You did a fine job of recognizing what you have to do. You got everything ready. I would just suggest maybe you put some lubricant here and something. I mean, just give them feedback and make it as neutral or positive as possible. Correcting them all the time is going to lead, generally speaking, lead to a lot of negativity. And the last thing I want to talk about is interventions. How do we intervene when things aren't getting done right, when the child's rejecting what we have to do, if we have to do it in particular over them? I think, again, age appropriateness, you sometimes with very young kids, you simply have to find a way to do what has to be done. Giving shots as an example, drawing blood, even though it's a terrible experience for the child. As they get older, we can provide some education, some psychoeducation, if you will, some education that's appropriate to their age and stage and place. Stage meaning what is the situation we're talking about, not stage of development. And those kinds of educations are going to get more complex as the child develops, as the child gets older. We can try to model as parents, that is to say, model that we're adhering to our own plans or the plan involved, although that isn't necessarily so easy when a child has to carry out a procedure. And the other aspect is when we talk about consequences of not doing the procedure in particular, it's very important that we educate slowly and gently for what those consequences mean in the future, not to make the child be horrified, but simply to help the child realize there's a reason why we brush our teeth, there's a reason why we wash our hands. And finally, I would suggest that giving reminders to the children, not verbally necessarily, that can be easily rejected and kind of grind on a kid's nerves, but rather maybe put little reminders around, little Post-its or something on the refrigerator, or if that's too visible to other family members or to friends, put some Post-its on a particular bathroom window or the bedroom door to carry out something and do something at a particular time. And then I think it's important to give cues, whether it's Post-its, but some other reminder. Put the equipment out that needs to be used for a given procedure or a given activity, and kind of give some clues about the cues so that they see what's going on and they can kind of figure out that this is going to happen and needs to happen. And finally, I'd just like to say that every issue, every aspect of the process of what they have to do to manage their condition, every part of it is important to the child, even if some parts you might say and we physicians might say are more important. So give them appropriate feedback for the parts they do, positive feedback, and then work on the parts that they can't carry out. So I hope this has been a little bit important in recognizing that neither children nor adults are very good at complying, but we all try to adhere to the plans that we are given, generally because we know that means that somebody's telling us to do something that's good for us, but we can figure that out on our own with help over time.